order. Madam Clerk, could you please call the roll?
Ms. Naylor? Absent. Attorney Murphy?
Present.
Ms. Hurst?
Present.
Ms. Gresham?
Present.
Ms. Perez?
Present.
Mr. Collins?
Here.
Mayor Sarno?
Present. Is there a motion on the floor to go into executive session, please?
I would make a motion that we go and enter into an executive session for the purposes of collective bargaining, discussions of collecting strategy about collective bargaining, and we will return to open session for our meeting.
Thank you. Motion by Vice Chair Collins. Is there a second, please?
Second.
Second by Ms. Gresham. Roll call vote is required. Madam Clerk, please call the roll.
Ms. Naylor? Absent. Attorney Murphy?
Yes.
Ms. Hurst?
Yes.
Ms. Gresham?
Yes.
Ms. Perez?
Yes.
Mr. Collins?
Yes.
Mayor Sarno?
Yes, more than sufficient vote. This matter passes. We'll not go into executive session, so we have to log off. Thank you.
We would be looking to explore the waiver opportunity because we'd like to keep the 6 foot of distancing to stay with the CDC regulations. DESE is saying that's not required, and we could go down to 3 feet, and a lot of other districts have done that. The second part of the plan would be a second phase in for middle schools, and then the third group back, and we'll go into the rationale behind that, would be the high schools because of the difficulty of mixing groups at the high school level. So what we did was made an adjustment in our phase-in plan to deal with the current edict, if you will, from the commissioner, because he does have the power to monitor structured learning time, and that's how he's going after this. So based on that, we suggest the phase-in plan that would make the most sense is our phase 1 plan, which would be for April 5th, would be pre-K through 5th grade. And then the other groups we were talking about bringing back in our first phase. We talked about exploring the opportunity at one juncture to bring them back March 15th, given the fact that we don't have a collective bargaining agreement. And there's some other, the community's still in red. We think we should wait till April 5th. But so in addition to pre-K to 5, we'd like to bring in our first group, our 10th, 12th grade students for vocational classes only at Putnam, our high need students with students disability, and our SLIFE kids, our kids in the ELL programs that had significant interruptions in their learning, our highest need kids in the district, as well as pre-K to 5. The commissioner said he'd be giving us information in the future. The next group coming back would be the 6th through 8th grade on a date to be determined. He hasn't set that date yet. And then phase 3 across the state would be 9th to 12th grade. We still have the issues with MCAS that's still being debated. As we get kids back in, we're going to have to deal with MCAS, whether we'd have to bring kids back in for MCAS or they could take it remotely. Certainly the technology is there to take it remotely, but he hasn't given us a full clarification on that. They're holding on the MCAS dates. The key MCAS dates are for our 10th and 11th graders, because those are the kids that need to take it to get the competency determination. So we'd have to find a way to get our 10th and 11th graders back in, even if the high schools hadn't phased in at that point, to take the portions of the MCAS they need to, so they can qualify for the scholarships and get their competency determination. Should they want to do that, there would be other opportunities for retakes, but we think it would be a priority for us to organize our high schools to get those kids back in. So that was a drastic change in thought from the commissioner, but the idea of the pre-K to 5 kids coming back in first actually makes a great deal of sense, and something that we should work towards doing. And we'll have to keep you informed, and the committee has sent several letters to everybody about the MCAS, and that the fact of the matter is you really don't need the MCAS this year as a diagnostic test. Districts have other diagnostic tests. So there's still hope that he'd remove the MCAS requirement. But as of yet, they have not made that move.
Superintendent Ward?
Yep. The next piece to go with this, we planned several presentations for you on the key elements that would have to be part of the reopening plan to give you an update on that. And the next piece, I have Jeannie Clancy and Helen Carlton Harris, our health commissioner, who've been working with us very, very closely on all the medical guidance and on the return issues. So I think we'd want Helen to come on first and frame where the community's at relative to the COVID situation right now, which is a very, very important piece of this puzzle, and why we don't think, part of the reason why we don't think March 15th is doable for students returning. So,
And I appreciate the indulgence of the school committee for Commissioner Carlton Harris, and it's been Pat Sullivan too. They get piggyback, so they get allowed to get some rest, and then we can continue on with the indulgence of the school committee, if that's okay. Superintendent Ward, if you want to go.
So without further ado, I'd like to turn it over to our health commissioner,
And then we'll go with Pat right after.
who's been a key member of our team.
Thank you.
Well, thank you very much for this opportunity. I want to thank the Springfield School Committee. I know that you have very difficult decisions to make ahead of you. Also want to thank the mayor, AD Early, as well as Lydia Martinez, Jeannie Clancy, and of course, Superintendent Warwick. I am not going to take much of your time this evening. The graphs that I use to present the data in the city of Springfield are really up on on our city website. Please feel free to look at them. I know you have a meeting ahead. I have vaccination site numbers as well. And right now, 9% of the city has been vaccinated for their first dose. Now that includes, I do have the zip code data that I am happy to share with you if you would like. And I think that vaccination updates will be very important as we look to try to figure out where vaccinations are being in the city and who is getting vaccinated. I do have data. I don't have the data around how many people in particular zip codes are 75 and over, 65 or over, or have two comorbidities. So when you look at the vaccination data that I will put up on the city's website, please remember that it doesn't reflect all data. Right now, the city of Springfield is still red. And I think if you look at the statewide map, there are two cities that are still in the red in Massachusetts, in Western Massachusetts. They are Chicopee and Springfield right now. So to the point, we are still in the red. But I should also say that the data does suggest that we are decreasing our cases. So the average case per day over the last 2 weeks was 43. If we continue in that trajectory, then we will see ourselves going into the yellow category. However, we are not there right now. And so I will just say that we are still in red. Look at the data on the city's website. I will post the vaccination data tomorrow. I will get it over to Billy Baker for him to post. It is important to recognize that red does mean that there is a lot of virus that is circulating in the city of Springfield. The age groups of those who have been COVID positive, as you know, the majority, 75% of those individuals are under the age of 50, and then 30% or more are under the age of 30. We are seeing a slight uptick in the number of positive individuals from our institutions of higher learning. So I am seeing some trickle of cases as those students come back on campus. So I'm going to stop there because I think that you have a long meeting and there are other individuals that need to present. I am here as always to support Springfield Public Schools and the staff who are doing a wonderful job. So if there are questions that I am needed to answer, I am here. And so I'm happy to stop at this point and thank everyone very much for their time and attention. Thank you.
Thank you, Commissioner Carlton Harris. I'll open it up now so you get some rest on to school committee members that might have some questions before kicking over to Pat Sullivan. So feel free, school committee members, to ask Commissioner Carlton Harris any questions you may have. Any questions for Commissioner Carlton Harris?
I have a question.
Naylor, Ms. Naylor.
It's probably a random question. I don't even know if it's relevant, but what is the situation for people who want to, and I know part of the situation is that we don't have enough vaccination, but what's the situation for folks who are incapacitated and are not able to leave their homes? So if somebody's in the house and a parent of a child is not able to leave the house, but they want to be vaccinated, how does that work?
You're asking, do we have a strategy for homebound individuals to be vaccinated? And that answer is there is no broad strategy. We have, the mayor and I have met with the health commissioner for the Commonwealth. They have given us a liaison named Liz Cox. We are working with Liz to think about how we do transportation better. What we are telling our residents, school committee woman Naylor, is number one, check with your personal care attendants if you can't leave home. The second thing is there are primary care providers who are giving immunizations. And if that does not work, we are at this point trying to work with AMR to think about how we can better serve. As you might imagine, it's going to be important that we have routes or we have places where we can send individuals, but not just one at a time. That's going to be difficult for us to do. So we really do need a broad strategy like they have stood up in the eastern part of the state. But we did make that gap in services known to Commissioner Monica Burrell when we spoke with her, as well as the liaison. So I would just say more to come. Please stay tuned. We know that that's a challenge.
Thank you, Ms. Naylor. Any other questions or comments for Commissioner Carlton Harris? Say again, any other questions for Health and Human Services Commissioner Carlton Harris? Okay, Helen, I think you might be off the hook. Get some rest. Okay, I'll see you tomorrow morning. Anyways.
Thank you, Helen.
Thank you, Helen.
Thank you.
Next, I'd like to
We're
give
gonna-
it to,
Director Sullivan.
and Pat's going to talk about the ventilation work. He's been working tirelessly with our consultant on the ventilation work, and just incredible work. I think the best work in the Commonwealth of Massachusetts on this. Pat and Helen have been like part of our team. They're in contact with us every day and working so to make sure our kids could return safely.
Just before Pat starts, and that meeting with Commissioner Monica Burrell, Helen and I, she did state, and I don't know if Helen's still on, Springfield is ahead of everyone when it comes to attack we've put on and this COVID-19 all around, physical plant, testing, everything we're doing. She made that comment and things on it. So that's a testament to all of us. Yeah.
I just want to thank the school committee for your support in getting us to this point this evening. We've reached that milestone that we set forth with you in early January to make early March. Bob Kirchner completed his plan. He wanted to review 3 of the locations of the 5 before he released his report. So I think the superintendent sent this report to you that outlines basically everything we've discussed since December and how we were going to approach the HVAC systems of our schools. On Monday, we toured Brightwood, Palmer, and Springfield Public Day Middle on Eastern Avenue. And Mr. Kirchner was very pleased with the upgrades that we had made to those facilities. So he feels now those 3 schools meet the standards that we set forth. And he will be touring the remaining 2 sites, Springfield Public Day High, which is the Holy Name campus, and Kensington Avenue School tomorrow. And he will more than likely, I would assume we did the same work in those locations, so I'm confident he will be basically passing those 2 buildings to meet the standards. We requested him to send a letter so the school committee could have that to have full confidence that all of our school buildings meet the plans that we set forth on. So again, I just want to thank you and the mayor for, we've spent over $1 million in the city of Springfield to ensure that our school and municipal buildings do meet the standards set forth. And I just want to thank Danny, Pat Roach, and the entire team for their support for getting us here. It's been really an amazing effort. And I also want to just give a shout out, just so you know, the tradesmen have worked across trades. They've worked great together. And they saved us probably $1 million because we did a lot of this work in-house. And then the last thing that we are working on, and I believe we'll have this done by early March, not required for this plan, but in schools that have gymnasiums that have air system, the mayor has given us the resources to put highways in those buildings as well. So that'll be another layer of protection, not required. But again, we're going above and beyond to just give everyone peace of mind.
I'll open it up. Thank you, Director Sullivan. Please, any questions school committee members might have of Director Sullivan? Ms. Gresham?
Yes, thank you, Mr. Mayor. Thank you, Mr. Sullivan.
Yes.
So I know last time we mentioned the wastewater testing. Has that been done, or where are we with that?
I called our industrial hygienist, Bob Kircher, the following day, and he said those studies wouldn't really relate to Springfield. He felt those are really for communities that just really have 1 or 2 lines, so you can backtrack them to an area of the city. And ironically, Channel 22 is doing an I-team investigation on South Hadley that did the study. I haven't seen the report, so I won't. I'm going to watch it tonight to see what the outcome of that study was. But in Springfield, all of our wastewater is contained, and it goes to Bondi's Island, and we wouldn't get those results that you were speaking of, tracking the virus. So I think the work that Helen does by tracking by zip code and so forth would provide you the information faster than that wastewater treatment. It just wouldn't be possible to do in Springfield because of the size of our system.
Okay. All right. And I was reading also in the report that we got today. So where are we with Conservatory of the Art? With that assessment?
Yep, so Steve Desolate and the owner have had one meeting, and they are going to meet possibly tomorrow or Monday for a follow-up. So I should have hopefully some good news on that school information by the middle to end of next week. So those meetings have started with the commission, with our building commissioner.
All right. So my third question, thank you, is so the I think it's MERV 13 filters.
Yeah, MERV 13, yep.
Yeah, are they completed in the schools that require them?
Yep, we actually have our second shipment. We have shipments of 3 and 4 on order. So we're going to meet that timeline for the replacement of those systems. So we have those in queue. And again, the mayor's given us the resources to purchase those and to have timely replacement of the MERV 13 filters.
So how long will that take to do that, to replace them?
They're already installed. And then that will just, we've always gone around and replaced the filters, so it's not a new task. So we will just do that on our normal maintenance schedule. So we've always gone through and changed the filters in our system. And I think that was one of the things I think Bob alluded to back in, I think it was early October when he met with you. He was really impressed with the cleanliness of our system and the high quality of care that's gone, because he didn't see that in other areas of the Commonwealth. So we already have a very good, and again, that's to your credit in supporting our budget request and giving us that team that goes in and does the maintenance on those HVAC systems. So we've got a team and we've got a thing in place. That is not a concern of mine at all. We will have timely replacement of those filters.
Okay, all right.
We already have the second shipment in the warehouse. We're ready to go. We're on top of it.
All right, perfect. Thank you.
Yep.
Madam Clerk, would you please recognize Vice Chair Collins is back on the meeting, please?
Yes.
Thank you. Any other questions or comments for Director Sullivan, please? Say again, any other questions or comments for Director Sullivan? Okay, hearing none, Pat, you're off the hook. Go get some rest. I'll see you tomorrow morning. Thank you. Thanks, Pat.
I have a question, but not related to Mr. Sullivan's report. On the website, we said something about having access to some type of video so that folks can see what the eye waves were and stuff like that. Is that on the website yet?
Oh, I'll make sure that gets over to you. I'll talk to the mayor. We had it on the mayor's site, so I'll make sure it gets to Patty McCarthy so she can send it out to you.
Thank you.
Yes, it's only like 2 or 3 minutes. Good, thanks. man.
Yes.
Thank you, Ms. Spanler, for bringing that up. Yeah, it's really amazing when you see that video. Superintendent Warren?
Yeah, Pat and his team have just done a fabulous job. I'm really grateful to him. He's been on with me every day working through all the issues. So, and this team has been incredible. Thank you, Pat. Now I'd like to kick it back to Jeannie, our nursing supervisor, Jeannie Clancy, on the medical issues associated with reopening.
I'm gonna be on
Jeannie?
contest.
Thanks again, school committee members, for your indulgence with Mr. Carlton Harris and Director Sullivan.
Thank you. Good evening, everyone. I'm going to present an overview of the guidance the CDC released on February 12th. The document provides 3 operational strategies for safe delivery of in-person instruction. They are mitigation strategies, community transmission to reflect levels of community risk, and learning modes based on the level of community transmission. Regardless of the level of community transmission, all schools should use 5 key mitigation strategies, which are use of mask, physical distancing, and cohorting or potting of students, which means keeping students with the same peers all day. Hand washing and respiratory etiquette, cleaning and maintaining healthy schools, and contact tracing. An additional layer of COVID-19 prevention in schools, but not required to open, are testing to identify individuals with COVID infection and vaccination for teachers and staff in communities as soon as supplies allowed. The CDC guidance recommends that schools providing in-person instruction prioritize 2 mitigation strategies. Masks are required and physical distance at least 6 feet should be maintained to the greatest extent possible, and cohorting or potting of students to minimize exposure across the school environment. The second operational strategy is community transmission. The CDC recommends school administrators work with local public health officials, and they should address the level of risk in the community. They recommend use of 2 measures. The first is the total number of new cases per 100,000 person in past 7 days, and the second is testing positivity rates in the past 7 days. If the 2 indicators suggest different levels, the actions corresponding to the higher threshold should be chosen. The third operational strategy is the learning modes. At any level of community transmission, all schools have options to provide in-person instruction, either full or hybrid, through strict adherence to the mitigation strategies. The CDC color codes are different than Massachusetts community color codes. Low transmission, they use blue. Moderate transmission is yellow. Substantial transmission is orange, and high transmission is red. For all schools that implement the 5 mitigation strategies and diagnostic testing, which includes pool testing and Binex Now, CDC says the communities that are blue or yellow, guidance allows K through 12 schools to open for full in-person with physical distance of 6 feet or more to the greatest extent possible and cohorting of students. For communities that are orange or red, guidance allows K through 12 schools to open in hybrid learning mode or reduced attendance with physical distance of 6 feet or more, which is required in cohorting of students. That's the summary of the guidance.
Thank you, Nurse Clancy, for all your efforts. Any questions or comments for Nurse Clancy's presentation? School committee members, please. Say again, any questions? Okay, hearing none, Superintendent Warren, please.
Next presentation is going to be on the high school hybrid learning experience, the hardest level to navigate, given the fact that we almost have to stay self-contained, of course, is the high school level. So Kim Wells, our chief schools officer at the secondary level, is going to go over what the high school hybrid learning experience would look like due to those constraints. Kim, as well.
Thank you, Superintendent. Good evening, everyone. High schools have been reviewing the schedules for the return to hybrid, and they've been doing really great work trying to figure this out. But as was mentioned earlier by Jeannie, regardless of the community transmission level, the latest CDC guidance recommends keeping students in consistent cohorts with no mixing between those cohorts. And this guidance was issued because with mixing across cohorts, one COVID positive test can result in multiple positive tests. And if the cohorts mix, those positive tests could be distributed across multiple classes, causing some real concern around spread. Just to kind of put it in perspective, I'd like to give you an example. When we did an analysis of our high school schedules under normal circumstances, we looked at a student at Central High School. Under normal circumstances, a student at Central transitions through 7 instructional blocks throughout the day and is in class with nearly 80 different students. If through testing, those 80 students, there's one positive test result, then all 80 of those students would have been exposed and be required to quarantine. Additionally, what happens then is when those 80 students test, if there's another positive test, and if those 80 students end up mixing with additional cohorts of students, then there becomes a real potential for spread within a school building should additional positive test results come about, which is where the CDC guidance is coming from regarding no mixing of cohorts and why the scheduling for high school is so difficult. Under normal circumstances, high school schedules are normally so individually tailored that students are mixing with different groups of kids each day. However, these aren't normal circumstances, and because of that, we'll continue, and because we want to continue to meet the academic needs of our high school students while conforming to the CDC guidance, high school hybrid learning will look different than the elementary and the middle school, where students can remain cohorted and remain in the same classroom throughout the same day with teachers coming to them. So, like I mentioned, unlike elementary and middle school, where kids are more self-contained, high school, the possibility to do that is just that much more difficult.
Thank you, Ms. Wolf. Any questions? Oh, she's still, I'm sorry, I apologize.
No worries. So as we mentioned, because the cohorting is so difficult, we have to make sure that students can remain in their current classrooms with their current teachers. So what we have to do is look at our hybrid schedule differently. And so as a result, most of their hybrid learning day will be learning remotely from the classroom. So I just wanted to provide an example of what that will look like. If a student arrives at school and goes to their first period class might be taught live by their first period teacher. But for the remainder of the day, the student would sign in via Zoom or Teams and join their classes remotely to avoid mixing with other students. That may look different from one cohort to the next. There may be potentials where students will have classes live with 2 different teachers, or there might be times where cohorts of students will have live classes with 3. But there are real potential because of the nuances in schedules that different students may go to class, have one live period with the teacher, and then the remainder of their day, they would be Zoomed in. Where possible, schools are making those adjustments, but it's just really important to stress that given the complexity of the scheduling, most high school students will experience many of their classes remotely while even in the school building. We remain committed to offering as much live instruction as possible, but we're prioritizing ensuring that students have continuity of classes and teachers earning the credits they need for graduation rather than rebuilding the schedules for the entire quarter, the fourth quarter of the year. And we're prioritizing this continuity because when we went through and analyzed the student schedules and their academic needs, we realized that it would be necessary to change more than 80% of their courses to ensure live instruction to consistent cohorts. And what that ultimately results in is schools needing to change classes and the teachers that the students have had throughout the year, which is not the best thing to do for students. The one exception to this rule, of course, is the schedule for vocational instruction at Putnam. Because students are naturally cohorted in groups by shops, most of the vocational instruction will take place live with the teacher. But with the exception of that vocational instruction, given the number of students who need to have individualized schedules to meet their needs, the ability to cohort students in the academic areas outside of vocational technical instruction really becomes a complex challenge that is just, it makes it almost impossible to do.
Thank you, Ms. Cole. Thank you. Any questions?
I have a
I
question.
have a question.
Me too.
Favorite first?
Me too.
Then we'll go down the.
So my question is this, right? I know that theoretically middle school students would be in one cohort, but I know that, I'll use my example. I know that kids have honors classes or other things where they are pulled out of their cohorts for certain classes. So the reason why I asked that question is for the same reason I'm gonna make this statement or ask this question. So how are the kids going to be able to Zoom into their other classes and stay within their cohorts? Are they going to be on earbuds all day as well as at their screen? Like, what does that really look like?
So when, School Committee Woman Naylor, when a student has to Zoom into their remote class, they would remain in their classroom. They would be seated at their desks with the desks socially distanced. They would sign into Zoom, and yes, they would get on their earbuds and they might Zoom into their biology class or their history class, whichever classes that schools are unable to provide live instruction to kids, they would then get on their computers and Zoom into those classes live.
So they'll be talking in their classes while they're sitting in another class being taught in a class?
Well, that's what we're working through. We're trying to set it up to the maximum extent possible so that there are no interruptions. If the students are on their earbuds, there would be some talking, but we're hoping that the spreading out of the desks and the fact that we're going to have as much to the extent possible students cohorted in like classes, that it would be minimized as much as possible, but there will be talking going on in the class because the teacher in the front of the room would also be working with a group of students. So yes, there could be talking happening.
Okay, I mean, I have 4 children and they're all remote and I have them all separated around the house because of the chaos it causes with them
Right.
being in one space. So I'm just visualizing that being total chaos. But the other piece of it is with the earbuds, are we providing those to kids or do they have to bring their own?
I think we've started to talk about that. Paul, do you want to jump in on that?
Yep, sure. Yeah, we're looking at it. Partly it's hard because we're not done with the surveying, and so we haven't placed an order for anything because we want to make sure we know students are coming back, when they're coming back, how many are coming back. But especially at the high school, which is what, as you said, at elementary, certainly kids can stay in the room all day with the same teacher. At middle, it's mostly going to be true, and there will be limited exceptions like you were talking about, where in middle school there might be one course where a student has to do like in this way. It's high school is where it's a much bigger issue, and so we've really been looking at the possibility of could we provide particularly something that is some kind of noise canceling headphones to support students in that high school setting, because we're cognizant of the what that experience is going to be like.
So I have a question.
Ms. Perez?
And probably it's not relevant, but we are discussing, is that a form of remote learning, and how it looks with the Department of Secondary Education wanting us to bring the students into the school for life learning.
I don't know, Paul, if you want to answer it. I think that's why I think you're making a good point. At this juncture with the community in red, it looks a lot more like remote, but it's actually in person live. That's why the Department of Elementary and Secondary Education, I would imagine, is putting the high schools into phase 3 and getting the other groups back first, because that's what we'd be able to offer, given the CDC guidance right now, would look a lot like what they're doing remote at home. So that's a very good point. And that's why we think parents need to hear that as they're completing the survey, so they understand what they're choosing. And that's why that group would return last, because it's not as robust as we'd like it to be. But it's the only way to keep the kids safe.
Okay, thank you.
I know there was other questions on there. I don't have a full screen, so.
Well, Mr. Mayor, I wanted to go if that's possible. So I actually had the same exact question as Ms. Naylor, and thank you, CSO Wells, for answering it. And I think that Mrs. Perez raises a good question as well. I guess I'm a couple things. One is, when you say we have to make sure that parents know what the exact setup is going to be, how are we going to make sure that they get this information? And I know that there was a decision made that once they selected hybrid or remote, that they had to stick with it. Is there going to be any flexibility? I'm thinking about the kid that ends up in this high school classroom and then goes home and says to his or her parent, I just can't do it, right? I just can't concentrate. There's 4 or 5 other kids learning at the same exact time. Are we going to allow that kid to then go remote?
I can take a stab at the first question, which is how are we noticing parents? We actually have, we're working on the messaging that will be going out prior to us starting the student family surveys for the high school. And we'll be working with the schools on crafting the message so that parents are aware of what the instructional learning experience will look like at the high school level. So they'll be made aware of that. We're also working on a PowerPoint that will detail what the setup looks like and what some of those situations would be, so that they'll know that while some of the students will have some live instruction, there will also be times where they will have to Zoom in remotely to some of their classes. So that's I hope is the answer to the first question. So we're working on that messaging so that families are, they have the right information needed to make the best decision for them and for their children.
So we haven't yet surveyed the high schools.
That's correct. We waited on those surveys for this reason.
Yeah, we call them a survey because we want to communicate this very, very clearly to folks.
And then the other thing I'll say with regards to the surveys is actually, School Committee Woman Hurst, we did start the surveys for the Putnam Vocational 10th through 12th, but we'll be conducting a second survey for the academic piece. So families will actually have the ability to make 2 separate decisions, because the vocational component, we're able to bring the students in grades 10 through 12 and do some live instruction because the cohorts allow for that. We could have families who decide they want to send their children to school for the vocational component, but because they might be less likely to send their children because of the academic piece, it's not an all or nothing situation. They could actually make 2 different decisions and decide to send their children for the vocational component, but keep their children home remotely for the academic. So we'll actually be sending out a second survey from Putnam for that specific reason.
Thank you. Can I also ask you, CSO Wells, will those high school students also have electives and or phys ed, or are those going to be, are we not offering those so that they can remain in these in classrooms?
So to the maximum extent possible, we will allow them, because of the pupil progression plan, to keep their courses, right? Because they'll need those courses for graduation and for credits. Some of them may be live and some of them will be remote, and that will depend on how the schools are able to cohort their students. And there may be situations where, depending on what's going on, a student may use our credit recovery program for a specific elective, but we'll still be able to provide those electives. In some instances live, like I said, and in other cases remote. But we have to make sure we provide them so that they get the credits that they need to be able to graduate.
Thank you.
Any other questions or
And
comments?
to answer the second part of Denise's question at the high school level, if coming back live didn't work for a family, we would let them change to remote because we'd be able to accommodate that. And we'd understand that, because I think that's gonna happen no matter how well we communicate it, and we'd be able to accommodate that request.
Thank you, Superintendent Ward. Any other questions?
May I
Comments?
ask a clarifying question?
Yes.
So the understanding of hybrid, is that the kids have the option of being in person or not, but the teachers are going to be in the building, correct?
Correct.
Unless they've received some approval for a health reason to be able to teach remotely.
Correct.
Okay, all right.
Thank
Thank
other-
you.
Any other questions or comments pertaining to this segment of the presentation? Okay, hearing none, Superintendent Ward.
I'll kick the next section to Paul, because this segues beautifully into the parent surveys that we've done so far and to how the choices are going at different levels. School committee's had a lot of questions about this. So Paul, if you could take us through the stats piece of this.
Sure. Thank you.
Like that. What up, Paul?
I'm happy to bring you some stats. So what you see here, I want to be clear, right? I've given you the percentages along the bottom, but the numbers are the actual numbers of responses. So we're as I think we shared with you the last time we met, we are early in the surveying. So we started phase 1 surveying prior to the February vacation. That's, the previous phase 1. We only started surveying for others just this past Monday. And as Kim noted, we have not started surveying high schools apart from the Putnam vocational decision and also high school SLIFE and low incidence students. So if you take a look, what you see here, the blue bar is the number of responses we've gotten and the percentage of responses, if you look down at the bottom, who are saying that they're planning to return to school. And then the green bar is the numbers who are saying they want to remain remote. Generally speaking, it's pretty consistent around 50% at all grade levels. You can see at KN1, there's a little bit higher percentage with our youngest students who are wanting to come back to school in person. And then to give you one other look at this data, this is showing students who are special education versus students who are not special education. And again, a slight difference with a slightly higher share of our special education students wanting to remain remote, but again, pretty consistently around that 50% number.
Thank you, Paul.
Any questions or comments?
I have a question. I have received many calls of parents asking me about the survey. They have not received it or they confused. And this is one of the problems that I want to present it tonight, or they are confused when the students are going to start in school. I need to know, how do we capture those parents? What's the model in place for those that have been calling me saying that they have received no information when it comes to the survey?
So I can say part of that is because what I said at the start, where we just started on Monday for the vast majority of students. So prior to Monday, schools had not reached out to any students who were not either SLIFE students with limited or interrupted formal education, students who were high need special education, or 10th to 12th graders at Putnam. So until Monday, that surveying had not started for the vast majority of students. So it's definitely the case that there's going to be a sizable percentage of families who may not have heard from us yet. And we haven't started surveying with high schools at all.
So it's done by mail or calling?
Oh, sorry. Yeah, so the other part is we have an online form in both English and Spanish, and schools are sharing that link. But if families have trouble with that or are not responding to the online survey, we're then making a phone call, and staff have the ability to complete the form on behalf of families as well.
Okay.
Thank you, Ms. Perez.
Can I follow up on that, Mr. Mayor, if I could?
Yes, of course.
Have we seen success either way? And I understand that we're in the infancy stages, but I asked that because in the summer, we got an actual phone call, right? Like my kid's counselor called and asked what was going on versus now we're being instructed to go to Class Dojo or go online. And so that might be easy for me, but what about the parents who it's not necessarily, the most simple task, right? Or for whatever reason, it's a little more difficult.
So
When are they going to execute phone calls?
it varies a little bit because, I mean, our schools are all different. They have different numbers of students to call. I can say that more, we've gotten more than half our responses are coming through the online form. But schools get a report every day that indicates which of their students have completed the form and which have not. And so that's they're going off of that form. So, it's going to vary a little bit from one school to the next, but they might look at their report tomorrow, for example. And if they see that there's a group of families who haven't responded, they might start making those phone calls. But again, because we started for most students just on Monday, a lot of the phone calling probably hasn't started yet because schools are giving families a little bit of time to respond online. But we're looking for 100% response rate to this survey. So any family who either doesn't do the online form or is having trouble with it, for whom it's a struggle, they are absolutely going to get a phone call. But it's going to have to take place over a period of time because we only have so many folks who can make those calls.
And so is there a deadline for responding? And I only ask that because, we might have families who are waiting, to get an actual vaccination, right? For a parent or a guardian to get a vaccination, and they've yet to make that decision or that determination until they know that they're able to do that. Is there a timeline in which we are giving families?
We have not been able, because as you heard from the superintendent, with the change from Commissioner Riley this week, it's changing the dates when we might be bringing students back. And so yes, we will have a deadline. We haven't been able to identify what that deadline will be for the 3 new phases that the superintendent talked about. I think tentatively for that new phase 1, that April 5th that the state is talking about, which would be all elementary students, vocational, SLIFE, and high needs special education. Tentatively, I believe we're looking at somewhere around March 12th when we'd like to have 100% response for that phase 1. But for middle and high school students, we haven't defined that yet because we're still waiting for the state to tell us what that date's going to be. We're trying to balance, just to say, what we're trying to balance is giving people as long as possible to have to make a decision for exactly the reasons you're talking about people wanting more information or wanting a vaccine or something else before they decide. But we have to balance that with being able for schools to plan and for transportation to plan for which students are coming back. And so we have to have some lead time once the surveys are done in order to do that additional work.
So I have a question, Mr. Foster. So whether the survey is online or it's a phone call, are they asked about transportation, if they will need transportation?
Yes. So it's really a 2-question survey. It's, are you planning to remain remote or come back? And then if they respond that they're planning to come back, we ask if you are eligible for Springfield Public Schools transportation, will you be using it or will you be providing your own transportation?
Do we know where we are with that?
I can certainly get you those numbers. I did not put it in the presentation tonight, but yeah, we definitely have those numbers. The last time I saw it, it's a little bit complicated because we're asking people if you're eligible, would you take advantage of it? So there are some people who are saying, yes, I would take advantage of it, who aren't actually eligible because they live in walking distance of their child's school. But what I can say is the last time I looked, about 75% of those who said they were coming back also said they would use SPS transportation if eligible. But some of those families aren't actually eligible because they live within walking distance of their child's school.
All right, thank you.
Any other questions or comments?
Yes, I have one more, if I may, your mayor. So, Paul, if a family has already taken the survey, are they able to take it again, or will it show up that you've already taken the survey? And I ask that question because if circumstances change for a family, might they be able to change their mind before we've actually gone back in? And I'm wondering, you know, we know that the governor or that there was a release of 50,000 vaccinations this morning, right? And so I'm thinking if we continue to get bulk quantity of vaccinations like that and people change their mind, what might be the impact on these numbers?
Yeah, I'm really glad you asked that. Actually, originally when we set up the online form, once they submitted their answer, they were locked in and they couldn't change it. Now, we were getting a lot of calls and emails for obvious reasons from families who something did change, and we made a change to the application this morning. And so as of this morning, if a family has already completed the online form, they can sign back into it, and there's a button that says update my response or change my response, and they can do that. Now, going back to the question about the deadline, after the deadline passes, once we set it, we will remove that button. So families who haven't yet done the survey will still be able to enter it. But after that deadline, we're going to remove that button. That being said, we will have a process where families, if they have a circumstance, they can reach out to us, to their school, and explain if there's a change that needs to happen after that deadline. And that's something we can do on the back end after that deadline passes.
So could I ask a question? So
Yes.
it will be like an appeal process, and who will be looking at those appeals for this changing from one system to the other?
Well, we're going to ask the schools to field those. Right now, as of now, anybody can go in and change it, and they will be able to do that until we reach a deadline. After the deadline, I don't know if I'd call it an appeal. We're just asking folks to reach out to their school, and then the schools can reach out to my department to have the preference changed on the back end. And I think to the point the superintendent made earlier, if somebody is saying, for example, I wanted my child to come back, but I'm concerned about something I'm reading about public health, or I'm concerned about my child's health, I want to return to remote. I generally speaking, I think as the superintendent said, we're going to try to accommodate that.
Any other questions or comments on this segment of the presentation?
I have a clarifying question, and I probably should have asked it the last time when Ms. Wells was on. I heard you say 10th through 12th graders. So does that mean the 9th graders are not in the plan to return in person?
The 10th through 12th graders are just, they're that phase 1 group that we originally had talked about. So that would be where we would be starting. And then later on in the other phases, we would look at that 9th grade vocational.
Okay.
So I was just speaking about that first phase.
Thank you.
You're welcome.
Any other questions or comments pertaining to this segment of the presentation? Okay, hearing none, Superintendent Warren, we'll move to the next segment of the
That'll
presentation.
segue perfectly into the transportation piece, and Pat Roach is going to handle the transportation section for us. Patrick?
So, hi everyone. I wanted to give you an update on transportation capacity. So DESE released some new guidelines this week. So what's different in these guidelines is they're allowing for elementary transportation to basically be full as it was in prior years. So all the elementary kids can go on the buses in the same access as they were in prior years. For middle and high school students, the new regulations require 2 per seat. And that's actually how we do the buses anyway. So 2 per seat causes any capacity. And I know this question was posed to Paul earlier, but we're assuming 30 to 40% of the kids won't be on the buses as well, because they'll either be remote or they'll find their own transportation between getting to the bus. So we're expecting reduced ridership anyway, as it is. So we're in the process of redoing our routes, making sure we can get all the kids to school. We've actually hired a consultant who specializes in this, and he's going to help us optimize the routes. And we don't expect to have any issues getting the kids to school, no matter whether we're hybrid or whether we're back fully in person. And with that, if anybody has any questions, I'd be happy to answer them.
Superintendent Ward pointed out, because this is going to take this change.
The guidance just changed last week, yeah.
So the weather will be warmer April. Now we'll be able to get kids on the bus because the CDC rule is that they just simply have to crack the windows, and we'll we'll have more leeway on the bus, but Superintendent
Plenty
Warwick,
of fresh air exchange, so there won't be any issues now with transportation.
that's a big, that was always a big headache for us, so that's sort of positive news in a way. Very positive. Any questions on Mr. Roach's transportation?
Yes, I have a question, Mr. Mayor.
Discussion.
Thank you. So, Mr. Roach, so they won't stagger the seating now, zigzag more or less?
No, we'll be able to fill the buses. So in the elementary, we can put the kids on as if they were in prior years. And then in the high schools, we'll be able to put 2 per seat.
Two per seat.
They would have to have masks and everything on also, Barbara.
They're going to be wearing their PPE. The bus windows are going to be cracked at a minimum 2 inches. And we're going to load the buses from back to front and exit them from front to rear.
Oh, okay. So, because I know earlier we talked about one child by the window, then the next at the beginning of the seat.
Yeah.
And a zigzag.
Yeah,
Those were the original guidelines, Ms. Gresham, and DESE since updated them.
So I have a question.
Discussion, that was a good point, because that was our concern.
Yeah.
We were ordered back and it was still on the guidelines of, because we triple tier, let's say the bus seated 77 or 72, you go 1/3. How would you do that if you have to triple tier? So thank you, Ms. Gresham. Ms. Perez?
Oh,
Yeah.
I wasn't quite finished.
I'll go back to Ms. Perez.
Okay, so how will they clean the bus? How is that going to roll out?
Yeah.
So the bus companies have committed to cleaning the buses between each route. I'm not sure. They're using CDC approved cleaners, and I believe that they're like the spray guns that they spray down the seats.
Okay.
All the seats will be disinfected.
All the seats will be disinfected. Okay.
Thank you, Ms.
All
Perez.
right. Thank you.
Ms. Perez, I'm sorry, Ms. Perez?
You know, it's kind of confusing because if we have 2 students per seat, what happened to the social distance that is required? I mean, that
So
is my concern.
DESE changed the guidelines. They had studies done. There's some scientific evidence that the amount of fresh air that enters the bus by keeping the windows cracked while it's driving over 2 inches is so significant that with the kids wearing their PPE and sitting there, that there's no spread of COVID, according to the research that they are publishing.
So I'm sorry.
Go ahead. Go ahead, Ms.
So where are the people? So will they be given a mask when they enter onto the bus?
So the students are supposed to be wearing a mask. So they should have it on at the bus stop. They should have it when they get on the bus. However, we will have extra PPE, both masks and face shields for some of the special ed kids in case for whatever reason they don't have it with them when they try to get on the bus. We will have extra PPE available, and they'll also get hand sanitizer as they're entering the bus.
Okay.
Me too.
That just, I don't know, something about that just doesn't add up to me with respect to safety and health-wise, because as Mrs. Perez said, two students on a seat, that's hardly even 3 feet apart. Even though they're wearing their mask or the PPE, whatever, that doesn't make a lot of sense to me.
That's the ruling with the Mr. Riley and they were all from the eastern part of the state. I did note that, sending it back, that there was no medical professionals from Springfield or Western Mass area, but that was all from eastern part of the state, highly respected physicians and medical professionals indicating that from all the leading institutions that now is not an issue.
Right, I understand that too, but
I'm just saying that they say it's not an issue.
Right, and then having the windows cracked a inch or half an inch, or a lot of times some of the students don't have on warm coats and jackets, So we have to take all of that into consideration.
But it is going to be April at the earliest, so It's not like we had to do this in the winter.
That'd be a
This would
different
have,
story.
would have been undoable in the winter.
Do it.
You know,
Just-
yes,
Yeah, I don't, who was, I didn't know who jumped on. I don't have a full screen here.
yeah,
Sorry.
Mr. Mayor, Ms. Perez,
Okay,
you know, it is confusing because then I'm reading the CDC guidelines and then the Department of Secondary Education guidelines is so confusing. It is very confusing because, you know, I'm still, I don't know, I don't feel that health-wise, having two students sitting down together, I don't know.
Thank
That's,
Any other questions?
Can I, yeah, I would, I just want to make sure that I voice my opinion.
Go ahead, Ms. Hurst. Go ahead.
I'm sorry. I mean, I would agree with Mrs. Gresham and Ms. Perez. At least for now, I mean, I feel like going to the 3 feet is a stretch when we're trying to make folks feel comfortable about transitioning back. And in particular, I don't know if you said it, Mr. Roach, are these our elementary students who don't necessarily or may not keep their mask on the same way that older students who understand the importance of keeping those masks on? I mean, what is the current capacity of the buses that we have? Do they have to sit 2 by 2?
Well, we're expecting 35 to 40% of the kids to not even be riding the bus. So our capacity is going to be way down. And that's also assuming that we go back in full. If we go back hybrid with like an A group and a B group, then those numbers will be cut in half even more.
Yeah.
So the capacity is going to be, starting off in April, the capacity is going to be so low on the buses, everybody can be spread out much more than what you're picturing.
Vice Chair Collins?
Yeah, it's certainly kind of an interesting study. You open every window 2 inches, which I understand will change the air at a certain rate, but it seems to forget about droplet and the way they travel, and the amount of wind in a room used to be considered, if there were fans in the restaurant, it would spread the droplets further. It's very interesting study.
I guess the only thing I can equate it to as an example would be they've shown that on airplanes, there's very little to no spread on an airplane, and they're sitting people seat by seat on a whole entire plane, and they're very close, much closer than they would be on a bus. And, you know, they're recirculating the air on an airplane. They're not even getting that level of fresh air coming on. And they've had lots of studies that the transmissions aren't happening.
could I say
And
something?
I understand that on the plane, and I do, and I know they're recirculating and they've upgraded their filtration. It's the wind of the wind going by and blowing droplets around I find interesting. It's like a lot of the other DESI stuff. You know, we can go to 3 feet. We don't need to go to 6 feet. Seems to be it was designed to get to the place where you wanted to be.
Ms. Perez?
Yeah, and I understand about the plane, but we are discussing children here, and it's like Ms. Hirsch said, they're not going to be following the guidelines as an adult will, you know, keeping that in mind. And that's my concern, because then they're going to be traveling with a backpack. They could touch each other. I mean, I have concern. I mean, it's that it's so confusing. We're trying to adhere to this guidelines, but at the same time, I feel that we're in violation of the CDC guidelines. So I hope you understand what I'm trying to say. And we eventually, I don't know.
Thank you.
May I piggyback off Ms. Perez? What happens if it's raining or something and the windows can't be open? I just feel like we're putting our children at risk. And I think, to everyone's point, I think at this point, we really need to think about how do we, and I think what I understand, and I'm kind of reading between the lines, is that if we have more than the capacity to be able to have kids sit a certain feet away, then we would need more busing. And we're not going to get more busing if DESI is saying we don't need more busing. So I feel like that's ultimately probably the issue, is money. But I also feel like if we could at least encourage the students that they have to sit a certain amount of feet away from each other. And then if it's necessary at some point, because we don't have the capacity, then we revisit that, but to just let them sit next to each other and not make it a guideline that we suggest that they follow, even though DESE is ignoring it, because to Ms. Perez's point, the CDC guidelines that we receive were pretty strict and much more strict than what DESE has been giving us. And I think we've had a knack for identifying where we can push it a little further than what DESE is recommending to make sure everybody is safe. So I would hate for us to not do that in this situation as well.
Ms. Naylor, I completely agree. And the bus companies have already marked those spots on the seats where the kids can sit. So we're already kind of thinking that way.
In the bus, we're going to be able to spread them out way better than their guidance, and we will do that. We get what you're saying.
Thank you, Mr. Any other questions or comments pertaining to this segment of the presentation and transportation? Okay, hearing none, Superintendent Warwick, thanks, Beth. Superintendent Warwick, next, last is, I think, Azell.
Thank you, Mayor. We have Azell on the communication piece, which is key to everything. So Azell.
Thank you, and good evening, everyone. As was stated earlier this evening, the focus and the goal and the aim of communication at this point is to provide information for parents so that they are armed with what they need to know in order to make a decision for their child or children returning to school in person or remaining remote. And so the communication department has been working very closely with schools because schools are the direct contact to parents. And so we have been providing materials for schools, scripts for them to use when introducing new information to parents, when reaching out to make phone calls, and when reaching out to provide surveys for families. So our schools are the direct outreach to families, and we're supporting schools with that. We have provided already a PowerPoint for schools that provides information about mostly around safety and precautions and what it would look like in terms of social distancing and those sorts of things in schools. And so we provided that to schools so that they could post it on their modes that they know their families flock towards. And we've also posted it on our website and on our social media channels. The hybrid plan that the school committee that you all had approved has been posted online, has been shared with schools so that they're able to direct families to that. And some key points from that plan have been pulled out to create a frequently asked question flyer so that parents won't have to trudge through all of the details in that document. Right now it's in Spanish and English. The hybrid plan itself the frequently asked questions are in Spanish and English. The hybrid plan itself is being translated, and language sensitivity is key to all of the communication plans that we have. And we've been working closely with our liaisons who have worked with us when we did our town halls to communicate and to provide the languages that their families need. Just today, we posted online and on my SPS a video that really talks about what the ventilation upgrades in the schools means and what they look like. It was filmed on location in 3 different schools representing each of the 3 tiers that the ventilation upgrades have fallen under. And so we want families to be able to understand that, and staff as well, to be able to understand that as they think about, going back into our buildings. What we are currently working on is a PowerPoint that will detail what the new school day and what the new academic protocols will look like. This was alluded to earlier. Chief Schools Officer Wells talked about this document that we're working on that's in progress now. And we will have that ready before high schools start making phone calls, but even before that, because we want elementary and middle school families to have this information as well. We're also working with Sodexo. Sodexo will be producing a video as well that talks about food safety and explains the protocols that will be taken to ensure that food is distributed in a safe manner. And we're also planning to create a video once again on location in a school that would demonstrate visibly for parents, what a one-way hallway will look like, what social distancing in a classroom will look like, what hand sanitation stations look like, so that parents get a real feel, an actual visual of what a school and a classroom would look like. And so these are the initiatives that we're currently working on, and we will continue to work closely with schools to make sure that parents have the information that they need before, as they make that decision. And once we move into that next phase, the communication process will of course continue.
Thank you. Any questions of Ms. Murphy-Cavan? Okay. Hearing that, Superintendent Ward?
Oh, that completes the presentation.
Okay, if there's no other questions or comments, I want to thank everybody on the administration side for all your continued dedicated efforts. I know the Superintendent Ward feels that way, and school committee members. With that, is there a motion to adjourn?
Mr. Mayor, just if I could make a comment before we go. I really, the staff, we keep changing the goalposts for them. And every time we get together, they have done an unbelievable job to put together, some type of a new plan to address it. I mean, just thank you all. I can't imagine the stress and the work that you're being put under. So from all of us, thank you so much for everything that you're doing, because you're all doing it for the kids. I was delayed coming into the meeting because I had to go to another meeting, and I got put on hold for that meeting. I got a chance to review that flood of emails that people saw coming in today. I will tell you that almost all of them had a completely different tenor, and what they were basically asking us as a committee to do. And when I tell you this, you're going to see that it lines up exactly with what we believe, is to seek the waiver to allow us to slowly use our plan to do a slow and thought out implementation of moving from remote to hybrid to full, and to ask that the teachers be moved up and get their shots more quickly. I can tell you that everyone on this committee, and you all should chime in, we feel exactly the same way as the 98% of those people who corresponded to us today did. So thank you, staff. And yes, you're on the same wavelength as us, teachers.
And just to let you know, many times when we're conversing across the Commonwealth and the state, it has been said that Springfield, whether on the city side or school side, is really ahead of the curve. And we're looking to do more. We're not perfect, but that has come across in meetings that I've been involved in. So everybody involved, thank you, because we're the old that. What's that, Daniel line? We're flying the plane as we're building it.
But I'd just like to add to what Chris said. The staff has been unbelievable, and it's been 24/7 since this pandemic started. And the constant changes, they've stepped up to do a great job. So I just want to thank, from the bottom of my heart, the great staff we have.
Now, is there a motion to adjourn?
So moved.
Oh, okay, thank you. It was a little delayed reaction there. You have to serve mimosas or something, for Christ's sake. Okay. Vice Chair Collins, is there a second?
Second.
Oh, well, okay. Everybody comes. All right. Second by everybody. Roll call required in the Zoom meeting. Madam Clerk, please call the roll.
Ms. Naylor,
Yes.
Attorney Murphy,
Yes.
Ms. Hurst,
Yeah, absolutely.
Ms. Gresham,
Yes.
Ms. Perez,
Yes.
Mr. Collins,
Yes.
Mayor Sarno.
Yes, board of sufficient vote. This measure passes. Thank you for watching. Good evening and good health, and God bless.